Well, the CDC data shows that RSV hospitalizations have now reached peak levels not typically seen until late December. The respiratory virus has been spreading quickly and hitting all ages, but young children so far are the most effective group. As you see here, Chief Health Editor Dr. Partha Nandi has joined us now. And Doc, give us some perspective on just how impactful this virus is right now.
Sure, Brian, the RSV season is not starting off very well. 77% of pediatric hospital beds and 80% of pediatric ICU beds are currently in use nationwide, and that's according to the U.S. Department of Health and Human Services. As for the CDC, the latest data tells us this, that nearly 4 out of 1,000 infants 6 months and under, and get this, more than 2 out of 1,000 infants 6 months to 1 year have been hospitalized this season because of RSV. It's a little scary to me, and the season is just getting started. Looking at October's weekly case counts, more cases were detected each week during that month than in any other week during the last 2 years. And for the week ending October 22nd, cases were more than double than any other week during the years 2020 and 2021. So that just shows how fast RSV has been spreading in our communities. And the total numbers are likely much higher because not every hospital, Brian, and laboratory participates in the surveillance program.
It's an interesting note there. So why is RSV so hard, particularly on young babies? And when should someone with RSV go to the hospital?
Yeah, this is important because we know that kids have died from this. Unfortunately, it often hits our youngest ones the hardest. In fact, in infants, RSV is the leading cause of bronchiolitis, which is inflammation of the lungs' small airways. And the reason why is because the airways are not wide enough yet, and the inflammation that develops can restrict airflow. Premature babies are especially at high risk. Why? Because their lungs are underdeveloped. And other high-risk children include those with weakened immune systems, congenital heart disease, lung disease, or a neuromuscular disorder. If you think your child is at high risk, I would suggest you talk to your doctor about the drug palivizumab. And it's a monoclonal antibody that can help protect kids by giving them antibodies to help protect against RSV infection. But for most folks, right, most people, RSV causes mild symptoms. It's usually just another annoying cold, and we get over it pretty quickly. Having said that, right, if anyone has difficulty breathing, this is important, they need medical attention right away. And if your child is under 6 months of age, head straight to the ER if they're also unresponsive, lethargic, or have a high fever, are dehydrated, or have shallow or rapid breathing. That's how we can get on top of this and prevent more deaths and more tragedies.
All right, Dr. Nandi, as always, thank you.
My pleasure.
And if you have a health question for Dr. Nandi, you can email him, drnandi@askdrnandi.com, or send it to us on Facebook or Twitter.